we have these anemia and constitutional related symptoms that often are the defining issues that relate to how a person is feeling and doing. And we do have these different options now. DIPS is the oldest, then we've got the plus. We also have the MIPS and the plus and the 7B and the 2.0. There's a whole bunch of different ones. What I would recommend is that you use one of the more recent ones that includes the mutational profiling, because that's usually going to give you a more accurate prediction of the likely transformation rate and overall survival in a population of patients like that person you're seeing. Here on the right is the MIP 70 plus. But you can see here circulating blast 2% or more matters, symptoms, the very high risk karyotype, and that's more explicitly defined when you look at this calculator. Whether or not you have a high molecular risk or HMR mutation, those have been defined. Absence of a CALR. So it's not all CALRs that are good. It's the CALR type 1 that's good. So you have to look at the NGS panel for that and then put that into the calculator, and you get points. And depending on how many points you get for having or not having these things, you go into one of these categories. So with the MIP 70 plus, it's very low, low, intermediate, high, or very high. That looks exactly like the IPSSR for MDS. Of course, now we have the IPSSM, which has 6 categories. So that's gone molecular too. Well, we've had these molecular data for MF for longer, and it tends to work better.